Hello, this is Dr. Ford Brewer, state-of-the-art preventive medicine, access for anybody who knows how to get into YouTube. Today I'm going to talk about glucose testing. Yes, I mean getting a glucometer, doing a finger stick and checking your own glucose. I know that sounds really weird, but let's consider a few things. First of all, let's talk about how the ADA, American Diabetes Association, diagnoses or suggests standards for diagnosis for diabetes. A hemoglobin level of 6.5%. Again, there's at least 10% variation, and I can tell you there's a lot of inflammation being generated way before you get to 6.5%. Consider it, this is the most common way for the current medical standards to diagnose diabetes. They also suggest maybe a fasting plasma glucose, a fasting glucose of 126 or higher. Again, way too high. They look at oral glucose tolerance test. Their view is a glucose level of 200 or higher during that test. Again, way too high. You see plenty of people with much lower levels who have significant inflammation and significant plaque deposition due to their insulin resistance. My mentors and friends, Amy Doneen and Bradley Bale, recommend an oral glucose tolerance test, and they are correct. It's far better than hemoglobin A1C or fasting glucose. It's far better than what you see in the standards of medicine. Here's the only concern I have with that, though. There's clearly variation on a daily basis of your blood glucose levels. Stress, exercise patterns, diet, all of these can change your blood glucose and insulin response during day by day. So why not take your own health into your own hands and stop waiting for some tests that might be helpful, might not be. It's simple, it's easy. How do you do it? Get a Freedom Freestyle. Spend $20 at Walmart or one of your local pharmacies. Just get it and then just do it. It's not that difficult. Find the directions. I'm not going to go over the directions on how to do a finger stick. Again, you can find them elsewhere on the internet. Do it 4 times a day, maybe up to 8 times a day. Important to get one when you wake up and get a couple after your meals. Now, think about this. Again, talking about waiting way too late, one of the standard thoughts is 100 is the right glucose measurement. No, it's not. The best glucose measurements should be in the 80s. Richard Bernstein, the father of the low-carb diet, is 85 years old, is a brittle or type 1 diabetic, has had diabetes since he was 12 years old, and has maintained blood glucose values in the 80s. He does not have significant beta cell function in his pancreas. He's done that through diet and lifestyle. So again, take your health into your own hands. Stop letting this #1 cause of cardiovascular inflammation, heart attack and stroke, sneak up on you and do damage on your arteries for years, maybe often decades, before you even know that it's working on you. Thanks again. This is Dr. Ford Brewer. Heart attack and stroke prevention, available to anyone who wants to go into a YouTube channel. Subscribe. Thanks.